Thank you, Harvey. That was very moving from the heart, too. Thank you. Bob Bernstein is going to comment. Bob is the president and CEO of the Bazelon Center for Mental Health Law, and he's been a real strong advocate for people's rights, and always hard to know what he might say.
It happens.
It happens, but it's yours.
Thanks, Dan. And excuse me, I want to actually really thank the Institute of Medicine, the Planning Committee, for carving out some time, allowing people with lived experience to really sort of reflect on what all of this means, because I think the danger is one can get caught up in the science of the matter and not put that science within the context. And for that reason, I just really want to applaud the panelists who, yes, that was me applauding. I see, you never know, I'm that good. I really want to applaud the panelists for being so open about how this feels. I'm coming from the Bazelon Center for Mental Health Law, and we're a national civil rights organization that's very much involved in the kind of issues that were raised today. And what doesn't get talked about is that when these horrible but thankfully rare incidents hit the media, we all just cringe. And what happens at the Bazelon Center, because we have some prominence, is our phones ring because the media wants to know, well, what do you have to say about civil rights now? Because something awful has happened. And I'd like to share with you a little bit about what that's all about, not so much to give you new content, but to put a frame around what people with lived experience have been saying. And I don't want to spend a lot of time, so it'll be sort of a minimalist frame, which is kind of chic. But there are some things that I think really add more complexity to an already complex scenario here. You certainly know that people with disabilities have, of all disabilities, physical, psychiatric, have endured a long tradition of segregation and discrimination. And in 1990, Congress recognized that and passed the Americans with Disabilities Act, which is our civil rights law. And there is a civil rights movement in mental health, just as there's a civil rights movement for racial equality, for gender equality, for sexual orientation equality. And we've been around. We've been around for decades. 1990 was sort of the crescendo of the whole thing. Congress recognized that discrimination against people with disabilities really has the impact of considering them as either incapable or unworthy of being a part of the social mainstream. And Congress enacted the ADA to remedy all of that. Mental health, in part thanks to the work of the Bazelon Center and other advocates in Washington, mental health was included among the disabilities that are covered. And I would argue, I think, based on fact, not just based on the reality that I work in this field, that people with mental illness have experienced discrimination and segregation that far exceeds what's already pretty awful for people with all kinds of disabilities. The discrimination and segregation in mental health has been tied with perceptions of violence and the need to physically lock them up in segregated settings. And you may know that in the 1950s, over 500,000 Americans were locked in psychiatric hospitals around the country, most of them not on treatment units, but on custodial care back wards, because they were really branded as hopelessly insane and violent and in need of segregation from the community. The ADA is quite a different view of the world. And you may know about the Olmsted decision relating to the ADA. That was a case where the Bazelon Center was very heavily involved. That was a case in 1999 that went to the Supreme Court, sort of challenging whether the ADA applies to people who have psychiatric disabilities and are institutionalized. And what the Supreme Court said is, yes, indeed, and in fact, unwarranted institutional confinement is a form of segregation, and that public systems have an obligation to provide services in the most integrating setting feasible. There are some limitations on that, but that's sort of the flavor. So that's very different from the history that folks with mental health have endured. That doesn't mean that magically everything changes. It's just like any other civil rights movement. When Congress acted around racial civil rights, the problems didn't just go away. It's been a long struggle. And we're here to talk to you about a long struggle that we're involved in. I want to say, and I really hope this doesn't get lost in the pessimistic discussion that we're having here. In the wake of the Olmsted decisions, some really wonderful, profound reforms are happening in public mental health systems in states around the country. New services are being devised, housing, employment services, assertive community treatment, mobile services, peer services, this whole array of stuff. But it mostly happens only when there's a threat of litigation hanging over systems. It's not kind of this natural, appreciation for civil rights movement that's happening here. Part of what's going on reflects the fact that the ADA wasn't the beginning of our history. It wasn't the beginning of the mental health civil rights movement. In the 1960s and 70s, there's no precise date, deinstitutionalization was sort of the first wave of efforts at reform. And deinstitutionalization was based upon the absolute horrific conditions in massive state hospitals where people were not only routinely incarcerated, but routinely put in restraints. That's just the way it was. That's how mental illness was conceptualized. And again, as I said earlier, hundreds of thousands of Americans were subject to that. The Bazelon Center, I'm proud to say, was involved in some of the early cases that challenged the constitutional violations that were there. And we helped spur deinstitutionalization. I'm bringing this up because, as I said earlier, whenever something tragic happens, my phone rings, well, what do you have to say about deinstitutionalization now? Well, it's a very good thing because most people with serious mental illness are doing not fabulously, but certainly fine enough, and they're not a danger to anybody. So we're certainly better off than we were. B, the conditions in hospitals were unspeakable. Even when hospitals were clean, just being in an institution, sometimes with thousands and thousands of patients, has its own troubles associated just with the whole concept. But the important thing that gets lost is deinstitutionalization was never supposed to be just about dumping people in the community. It was paired with a vision of community mental health, and this came from the Kennedy administration, sure you know this, and it was a whole new view of mental health. It was, we're going to change the world. We're going to move services from the hospitals into the community. We're going to think very differently about mental illness. You remember Thomas Szasz, is this a rational response to a crazy world? What does poverty have to do with it? What does racism have to do with it? And, the community mental health movement had a very brief Camelot moment. It didn't run on Broadway as long as we would have liked, but there was a moment where there was this sexiness to it and this can-do spirit. What happened is Camelot got defunded and closed abruptly. And what you see today, even though with Olmsted there are some real promising improvements, is you're seeing a shell of what should have evolved by this point in history. And as a result of poor funding and increasingly having to move towards just being a crisis system, a late-stage crisis system, not only have people with serious mental illness suffered, but perceptions of what serious mental illness is have suffered. And now, serious mental illness is seen as dangerous when it's not. And now, serious mental illness is seen as homeless, which it is, but most people with serious mental illness are not homeless. Unemployment among people with serious mental illness before the recession 70% unemployment. And then you ask why people get in trouble with the law. They don't have anything to do. Who knows what we would be doing if we didn't have jobs and we were out on the streets. So you're seeing the remnants of all that. The other, so deinstitutionalization in the community mental health movement, it's broken promises. The other piece of reform from the 60s and 70s had to do with civil commitment. And it used to be you were civilly committed because the doctor said so and you just stayed in the hospital. It was, you know, kind of a loosey-goosey thing. And the reforms from decades ago were that if the state is going to be so intrusive as to take away your liberties, it should be based on some objective criteria like danger to self or others. And that's where all of that came from. Danger to self or others was never, ever, ever supposed to be the standard for when you get services. It was simply the standard of when you would lose your rights and you would be subject to involuntary hospitalization. Yet, because of the funding cuts in community mental health, many, many community mental health services operate as if, unless you're dangerous, don't bother us. And they're victims of that because it has to do with resource issues. But what it means is they don't get involved in early intervention or prevention unless there's some special funding. And when there are budget cuts, that's the first to go. When you're cutting budgets, you don't cut your emergency services, you cut early intervention and prevention because there's no immediacy there. All of that has contributed to this way of operating whereby a good mental health system is supposed to be right there with the police when there's a crisis. And a good mental health system includes a mental health court. And what isn't happening is that the perception is out there that police involvement, court involvement, involuntary treatment are adverse outcomes of a system that's failing earlier on. That was what was interesting in the 60 Minutes thing when the parents said we were failed because they couldn't find a hospital bed. No, the system failed because there's a crisis. And that's totally missing and totally sort of feeding into this nexus between perceptions about violence and mental illness. I'll end by just giving you the paradox that's before the mental health field right now. Violence gets things on the front page. Violence gets the attention of policymakers at the federal and state levels. This means allocations might be made. So mental health can be opportunistic and step forward and say, well, you know, because of all this violence, you should fund us. But in doing so, they're spreading the message that mental illness is violence and that our role is public safety. And that's totally incompatible with all of this recovery philosophy that's out there. So it's kind of an interesting moment. And in addition to watching everything that the other panelists are saying, it's interesting to see how public systems and providers behave when this new perverse opportunity to get some resources riding the coattail of violence is presented to them. So I'll end it there.